Hi, welcome to Active Aging. My name's Danielle Procopio and I'm your host. Active Aging is a program that explores resources in our community that are helpful to us as we age. Today I'm very excited to be joined with two occupational therapy assistants. We have Miss Holly Masters as well as Izzo. Thank you girls so much for joining us today.
Thank you for having us.
Of course. So I just want you to tell us a little bit about yourselves and what you do.
Sure.
So I'm Holly Masters. I'm a certified occupational therapy assistant, and we're graduates of Penn State. And I'm currently working in an assisted living facility in Hermitage, and I'm from Gustavus, Ohio.
Perfect.
And I'm Izzo, as she said, and I'm also a CODA working in a nursing home and a local hospital. Like she said, graduated from Penn State, Shenango, so
perfect.
just on our way.
And I'm excited to have you both here today because we're going to talk a little bit about occupational therapy. Yes. A lot of times when people hear occupational or physical therapy, they always associate that with being in a healthcare setting. And there's so many ways that you can incorporate therapy into your everyday life. And I'm excited to talk to you guys a little bit about how we can do that and help our viewers today. So can you tell me a little bit about occupational therapy and what that is?
Yeah, so occupational therapy can help across the lifespan. So from the time you're born until, older adults. For us, we work with the older adult population. So a lot of what we do is try to keep people as independent as possible within their daily activities. So whether that be, eating, bathing, things like that, just trying to adapt their environment to keep them independent.
Perfect. Very good. And why do you think occupational therapy is so important in the aging population?
So I think it's super important because we are able to, like Ali said, adapt environments and really get to know the patient to see what they want to do. What are their goals? What is something that they have done in the past and currently aren't able to do? How can we get them to do what they want to do just to improve their quality of life overall?
Perfect. That's great. So I know, like we talked about, therapy is not always reserved for like a hospital stay or a nursing home stay. So what are some other ways that seniors can experience occupational therapy? Like where and when are they able to receive it, or what resources might be out there for them to utilize?
Yeah, so like for me, I work in the hospital setting, so we do therapy there. But then a lot of our patients will get discharged back home, and so they have the option of home health, someone just coming in and like she said, just focusing on their environment, where they live, and being able to, see what they need adapted in that setting. So that's very helpful within the home if that's where, they want to stay and that's where they're going to be living. But then there's also outpatient facilities and you can get OT anywhere.
Yeah,
pretty
honestly.
much anywhere with an address you can get OT.
That's good though. That's good that it's very accessible, because that's something that's important. And if you're not able to leave your home, to know that you have the resources to actually have a therapist come to you. I don't think everyone realizes that. And with the home health aspect, that's going to be covered normally by Medicare or Medicaid or your private insurance. So that's a resource that if you're struggling at home, you can bring in without having an out-of-pocket cost. So I think that's critical. And of course, our physical therapist friends and our speech therapist friends and nursing are also able to come in as well with home health. So I think that if people need assistance at home, it's something definitely they should talk to their doctor about in order to get that there, and that's good. So if I am not currently experiencing occupational therapy through one of those venues, what are some tips that you ladies can share with our viewers so that if they need some help at home, some things that they could be doing on their own, some different ways that they might be able to work occupational therapy into their life without therapist present?
Yeah, so these are just a few kind of toys, I like to call them, that we give out to our patients. This one a lot of people love. It's just a sponge on a long handle. So a lot of people, they may have a back injury, or, if you just had your hip or knee done, you're not able to, flex and move the way that you normally would. So this is good for, being able to shower independently and use it on your back, get down to your feet and your legs. So then you're able to bathe independently.
And I'm assuming that this piece here probably came from some type of medical equipment store, am I correct? But there are probably similar items that we might be able to get from like Walgreens or Walmart.
Yeah, you can get almost all of this stuff from Walmart for the most part.
On Amazon too.
And that's even greater because then you don't have to leave your house. Very good.
And then this one we love. This is called a sock aid. And so this will help people to be able to get their sock on without having to bend all the way over to their feet. So what you can do is just kind of bunch it up a little bit here, and then you'll place it right on the sock aid and make sure it's stretched all the way across the top. And then you just use the rope to throw it down to your feet, and you slide your foot right in here, and it comes off.
Fantastic.
So
I mean, use that.
It's so easy and it's so helpful.
Great.
Yeah, it works perfectly. And then I just have 2 things over here. These would be examples of like feeding adaptations.
Okay.
So this is called a nosy cup, and it has the nose hole actually cut out of this cup. It's really good for people that have a cervical injury with limited range of motion. So you don't have to move your neck at all to receive the liquids. And it's also good for people that it limits like the liquid intake, and it decreases the risk of getting the liquid in your respiratory system. So rates of pneumonia. This is an excellent cup. But pretty much all you do is you drink like normal. You just don't have to move your neck. It's very cool. And then also this is a bendable scooper bowl. So pretty much this is good for people that have to need a little bit of assistance getting their food items on their utensils. So for example, if we had cereal in this bowl, if you were to scoop it out like normal, you'd scoop it, but you have the risk of spilling it over the edge, not getting a lot on your utensil to eat. So with the scooper bowl, you can scoop it just like normal, just above the bendable edge, and all of that food will go on your utensil, and it really helps decrease spill rates too.
Fantastic.
Yeah.
And I know that, when we're talking about therapy in general, any type of therapy, you're trying to increase independence, and you're trying to, maintain that as well as increase that. So with occupational therapy and some of these tools that you're showing us, I know some of them might be a response to specific injuries. So you mentioned back, you had mentioned neck injuries, but these would also probably be helpful just for pain, I would imagine.
Yeah, honestly, for anyone, I was telling her that bowl, like, I could use that right now because I'm always spilling stuff everywhere. So, I mean, it's really good for anybody.
Perfect. Because like I said, I think that, a lot of people assume therapy has to be an intervention, a response that's going to happen after an injury or an illness. And, what we see is as we age and, as early as you ladies, and then much, much older, is that as the body ages, and it experiences wear and tear, you're exposed to arthritis, you have pain issues, chronic pain from a back injury that happened many years ago. So some of these things that you're showing today, it's not necessarily that you've had surgery or that some type of major events occurred, but they could be very helpful just to minimize movement in order to try to relieve some of that pain and make something as simple as getting your socks on a much easier process, because it can be difficult if you have a difficult time bending over. So I think that that's great. I think that those tools that you're showing us are a great solution for our adults that want to age in place. People want to stay at home as long as they can, and not only because that typically is a home they've been in with many memories for years, but also for cost reasons. There's definitely a shift to community-based services and an increase in home health, so people are able to stay home a little longer than what we've seen historically. And I think that these tools that you've shown us are a great way for them to maintain their independence. Do you think that occupational therapy itself is a tool to increase independence for seniors?
Yeah, so I mean, basically the whole idea of OT is just being able to keep people as independent as possible, whether that's adapting their environment or reteaching them how to do the things that they once did. So independence is a huge part of occupational therapy and really what we try to base all of our interventions around.
Awesome. Yeah, I know that that's something that we see a lot is that, as we age or as you start talking about bringing these adaptive environments in or moving into an adapted environment, that can be a real struggle because there's a loss of independence there. And I know we all want to keep our independence as long as possible. So in your practice, have you seen effects of loss of independence, or do you see that struggle for adults?
Yeah, a lot of times with me, my patients, even just general decline, and it's just trying to get them back to their normal routine, whether that's building up their endurance, activity tolerance, standing tolerance, things that you wouldn't think, you use every day, even transferring. All the upper body strength that you need just to be able to get up, transferring out of a wheelchair and your walker into the bathroom, into your bed mobility. There's just so many options that you don't realize that, this could be declining. So we can, absolutely bring you in, get the evaluation done, and then work on the goals that you want to work on. to get you back to
Perfect.
your normal.
Yeah. I know it's probably a struggle for some of our caregivers that are watching too, because until you're in a situation where you've been injured or you're in pain and you're not able to use your body the way you're used to, you can't really understand what that loss is like and how debilitating it can be when there's an injury. So I know with our residents and with the senior population, a lot of times that loss of independence can equate depression, because, even in the younger population, when something happens, and you're not able to move the way you were at one time, it can be difficult. So are you seeing a lot of depression with the adults that you're working with?
Yeah, I would say when they're not able to complete the activities that they once were able to, or, even just bathe themselves or, go to the bathroom themselves, you see kind of I don't want to say depression, but at least a sadness.
Yeah,
and
absolutely.
definitely like a social withdrawal. Like they don't really want to be around anybody. They just want to stay in their room. They're kind of just stuck on the fact that they can't do what they once were able to do.
Sure.
So that's why we want to go in and be able to, motivate them and say, we can get you back to where you were. You are going to be able to do this again. So we just try to find ways to motivate them as best as we can.
Right.
Good. How prevalent is depression in the aging population?
Yeah, so we were looking up some statistics from the CDC. They said that there's over 7 million older adults who experience depressive symptoms. So whether that just is, sleeping all the time or excessive weight gain or weight loss, just symptoms like that are leading them to an actual diagnosis of depression. So that was a really alarming number.
Yeah, that's
to us.
about half of our seniors then that are actually experiencing depressive symptoms.
Yeah,
Yeah.
scary.
That is a little bit scary. And of course, with that loss of independence, with the loneliness that comes along with losing loved ones or having to make major life changes, that could explain why those rates are as high as they are. But what are some of the other causes that you guys are seeing for depression?
Definitely other causes can be, besides loss of independence, like family members that live out of town, not a lot of social interaction with people, especially people that live at home, maybe by themselves. Sometimes they can feel isolated and don't come out of their house, after 3 days.
Yeah.
Don't get to talk to people that much. Also, diagnoses. So people that, are older, they have higher risks of being diagnosed with arthritis, dementia, Parkinson's, and that's a whole new lifestyle they're going to have to adapt to. It's a lot of changes, and it's scary for them.
Yeah. Yeah, change is hard for everyone. So I would imagine that, if you're facing multiple changes, typically a diagnosis is then followed by new medications or a hospital stay or, maybe a change of environment that could be very hard on our seniors. So I could totally understand why we're seeing that's happening and, what's going on. What are some of the treatment options that you guys have seen for our seniors that are experiencing depression?
So in the skilled nursing facility where I work, what we try to do is get the patients to all interact together. So we do a lot of group therapy sessions or just group activities in general to, kind of get their mind off of, if they do have a diagnosis or what they can and can't do, and just kind of interact with someone and, talk to them, tell their story, listen to other people, and kind of just get that interaction going.
Yeah, and then at my facility, we can Skype with the family members.
Perfect.
So that's been a really beneficial thing for our patients. They
Sure.
love that. They have access to a phone all the time. But then also, kind of like Allie said, we do group craft once a week, and then just also going in and having that personal connection, just taking the time to sit down with them and talk with them about their family, their hobbies, what they like to do, how they're doing, how are you liking your experience so far? Is there anything that you need changed, or what would you like to see in the future?
Sure. I think that when we talk about depression and we talk about, just in general, so many times the answer is pills, and so many times we go to medication for that. And I think by all means that has a place, and it's a great treatment option, and thank God that we have the options that we do. But I know that sometimes with our seniors it is very situational. It's the family members can't visit, or they feel isolated isolated or there's that change. And so sometimes if we're able to provide, some of those experiences for them, then we can avoid an additional pill that we need to worry about taking, or sometimes we can just alleviate the symptoms and then that will, get better. So it's socialization, such an important part, and maintaining socialization is such an important part of the aging process. And I think, facilities do a great job of, providing opportunities. So really those seniors at home that aren't in the facility, those are the seniors that I worry about, that we want to make sure we're creating opportunities for socialization for them. Are there any lifestyle changes that you think we could recommend for, seniors that are in a facility or that are at home that might be able to help with depression symptoms?
Yeah, I would definitely recommend trying to get into a routine, whether it's, you're going to meet your friend for lunch every other week. That routine has been really well. It's worked out really well for some of my patients. And then also just realizing that it's okay to ask for help. A lot of people, they've been so independent and they don't want to ask for help because they haven't needed it. So just taking the step to ask for help or reaching out to family. If they do live at home, it might be, realizing I can move to a condo or an assisted living that has a socialization and has a lot of the resources that would be able to benefit me every day.
Sure.
So just realizing that change isn't a bad thing too.
Yeah, it is a hard thing, but it's not necessarily a bad thing.
Right.
Yeah, and I think for seniors that don't have family or maybe aren't close to a lot of people, they can always reach out to their doctor too. That was, one thing that we always encourage our residents or people that we encounter, that, if you have a question, that your doctor is a great trusted resource that can help either get you where you need to go or get the right resources in the home, or can help you find where to get the assistive devices. So I think it's important too to be open with the physician if possible.
Absolutely.
Yeah, absolutely. So with everything that you two have seen in your practice, I know that you recognized there was an issue there and then you tried to provide a type of intervention. So tell me a little bit about your story with occupational therapy and our seniors.
Yeah, so as she said, we both went to Penn State Shenango in the occupational therapy assistant program there. And during our clinicals, we both worked with the older adult population, and we would just talk and say, we're seeing this sadness, we're seeing disconnect between the residents and their families, and what can we do besides therapy that can help these people?
Right.
So that's kind of how we came up with the idea of our purpose boxes.
Yeah, so our boxes, they are quarterly boxes, and the person can subscribe, so their loved one would receive a box every 3 months. You can add photos, a message, and then all the products in our boxes are functional. So we always have a purpose, and we're trying to tie in occupational therapy into it as well. So for example, August, our theme is cognition. So we're trying to stimulate the mind and enhance executive functioning. And then our themes vary every month or every 3 months.
Awesome. So what made you guys think of a subscription service? And some of our viewers might not be familiar with subscription services,
Right.
so I guess let's back up and talk about that for a second. So when you talk about a subscription service, we're talking about almost like a magazine. For
Right, that's how
the
I
easiest way to
explain it,
quote
too.
it. Yeah, and so you decide to sign up for something, and then instead, of course, of receiving a magazine, you're receiving a box of items in your case,
right.
but those will come regularly or as many times as you sign up for those. So when we're talking subscription service, it's a little different than what we've traditionally thought of as subscriptions, which is, magazines and whatnot. So what made you decide to go with the purpose box? Like what was the thought process behind that?
So one of the things behind it, we talked with some of the residents, and they just said that they loved receiving things in the mail. And, on their birthday or a special occasion, they'll receive a card, but for the most part, they're receiving bills in the mail. And they said, they said it's not very exciting, but they do love receiving mail. So we thought this would be a nice way. It's kind of convenient for families to be able to purchase it through us, and then it will get sent to wherever their loved one lives. And
Great.
they'll be able to get that in the mail, a nice surprise.
Perfect. Can you show us the boxes?
Yeah.
I love the color. They're very bright and happy.
Yeah, so this big box here, this is one of our quarterly boxes.
Okay. So that'll come out once a quarter.
Yes.
And there's a different theme for each of those boxes.
There's a different theme,
Okay.
yes. This theme here is cognition. We have a self-care, fine motor, and a strengthening box.
Great.
As well. So as she said, they're able to upload, a little message saying, we're thinking of you, see you maybe at a holiday or something like that, just to remind them, and they know who sent them the box. They're able to upload up to 3 pictures, so this is nice to keep them updated, on grandkids or life events.
That's probably my favorite part of your box, because I think that really personalizes it and it allows family members to put those photos in there, and that's such a nice surprise then for the person that's receiving it.
Right, and they're able to change the message and the photos every 3 months. So when the new box comes out, they can upload new pictures and a new message. From us, we like to send a little newsletter with it, just explaining the theme of the box, why we're sending you these products, how they're helping you.
Perfect.
A few just cute little facts that we have on there, and then we have a subscriber of the month.
Oh, how fantastic
a nice
is that?
picture and then just a little blurb about them.
Great.
So,
Yeah, so then it's the cognitive box. So one of our products is a coaster, but it's also a jigsaw puzzle.
Oh, how fantastic.
So it's functional. It's also magnetic. So if somebody were, to have tremors, this is really good for them since it's magnetic. And it's also visually spaced out, so there's contrast in there. So if somebody needs that, it'll be easy for them to complete.
Perfect. So they've got a fun item in there that they can play with.
Right.
Yeah.
And then we had here, this was just one of our favorite books that we've seen in the nursing home. It's like a 300-page book. It just has, puzzles, riddles, things to keep the mind stimulated. You don't have to use these things all in one day.
Sure.
These are products that they're able to use for months, years to come. We don't want to send anything that, they're just going to kind of use them one day and then be done with it. We want to send things that they're going to be able to continue to use.
Yeah, clearly there was a lot of thought put into what was in the box, so we appreciate that.
Yeah, and then there's a couple other things, but overall we don't put any food items in our boxes.
Great.
We know, dietary restrictions, and then all of the font is enlarged, and then if somebody would, need extra enlarged font, we are happy to adapt anything that we can.
Perfect. And these are shipped all over the country. So if I have a friend in California, we can get them there.
Yep.
I think that, one of the great things about this is not only for maybe family members of a loved one in a nursing home, but also just if I have a friend that's in another area, seniors themselves, this would be a great gift item that they might want to think about as something that they could send a loved one. So this one particularly is our subscription box. And how long do I have to sign up for a subscription? Is it 1 year?
So you can sign up to just pay quarterly.
Okay.
And so then they'll get it, if you did it now, they would get the one in August. If you wanted to cancel and just do the 1 month, just try it out, you're able to do that. Or you are able to subscribe for an entire year and get all 4 boxes.
Perfect. So there's a lot of good options there.
Yeah.
Great.
Yeah.
Now I know you have a couple other special
We do.
boxes. Okay.
So then these, we'll switch this. These are our one-time purchases. So these are our Thinking of You boxes. We have a men's and women's version, and then we also have a birthday box.
Oh, how fun.
So we'll just briefly go through like our favorite one of these. So the birthday box, all these boxes you can upload a personalized message to. This birthday box, you've got your sash, a little singing cupcake, things to celebrate your birthday.
So when I had said we talked to some residents about, what they would like to see in boxes, a lot of the men said, oh, we would like beer. And of course, like we said, we're not doing any food or liquid products, but we had found this beer soap. And so we thought that would be, kind of a little way to incorporate it, but
it's a good compromise.
Not having to send that. So that's kind of the men's version there, and then we have the women's version of the Thinking of You box. One thing we have in here, just a bracelet, but it doesn't have a clasp on it.
Oh, great.
So this is really great for someone, who may have arthritis. They're not able to, put that on independently and do the clasp, so they're able to just slip it on real easily and wear that. So that was one thing I liked about this box.
Yeah, I think there's a lot of thought put into these, and I think that it's nice that you have different options and different price points. So depending on how much you're looking to spend, you can either do a birthday or a Thinking of You or go full subscription.
Yeah.
Right?
Whatever they'd like.
Perfect. And I'm glad too to hear that you guys talked with a lot of seniors to see what they wanted in the box. So it wasn't just what you thought might work out well, that, you know, there was some input there from the residents and the seniors that you were working with as well.
Yeah, we got some good feedback from them.
It was a lot of fun to go in and like do a little questionnaire with them. They were so
I'm sure.
cute.
And I think we do have to give a shout out to Penn State as well. So tell us about how you got space in order to get your program.
So we go to Penn State Shenango, and we're returning for our bachelor's this coming fall semester. But we were able to complete this business idea as one of our classes. And when we were finished with classes in May, we were able to actually move into the Penn State Incubator. So they're really starting to push like entrepreneurs, and we are in Advent Penn State. We're sharing a co-working space with 2 other Penn State businesses. And it's awesome. I mean, we're very thankful for it.
Absolutely. I mean, and especially to have that kind of support, because you are very early in your career, you're very young ladies. So it's awesome to see that the university is recognizing a good thing and that they are supporting you and giving you the space to make this happen, because I'm sure you're bringing a lot of joy to a lot of lives through this program. So
yes, we're very excited.
So why do you think purpose is important? How do you think you're making a difference?
Yeah, so our main thing with these boxes, as we said, just trying to keep families connected. It's a big thing we know from like our grandparents. My grandparents lived farther away, so I didn't really see them as much. So being able to do something like this for them would have been really great for me.
Sure.
So that's something that we want to bring to families and allow that option for them.
Yeah, and also just that our products, like what you're sending your family member, is functional and it has a purpose. We're trying, to improve independence, well-being. So just knowing that it's always hard to pick out something for your older loved one. So this is a good option because, it's functional and it serves a purpose.
Absolutely, and I love that it's coming from a therapeutic place. So you've put a lot of thought into that, as well as considered what they want, even though we can't get them beer in the boxes.
Not yet.
Not yet. A future box, maybe.
Maybe.
So tell us how we can go about ordering a box if we're interested.
Yeah, so we have a website here, purposetherapybox.com. You can go on there, and we also have social media on Instagram and Facebook, so we can be contacted on there as well. But yeah, our website is up and running, so you're able to get more information. We have educational resources on our website as well.
Cool.
For caregivers and families.
That's great. I love that there's resources there that they can use as well. Yeah. So if there's anything you'd like to leave our viewers with today, what would that be?
Honestly, probably just, reach out to your older loved one, take some time, talk to them, let them know that you're thinking of them. Ask them what it was like for them to grow up, because those are awesome memories that you don't want to lose. And from our standpoint, we really just want to help decrease the loneliness that people have, and, bring families closer together, give them the pictures that they can look at, look forward to, and just really remind seniors that they still have a purpose.
Yeah, absolutely. Well, I appreciate both of you coming here today and talking with us about how occupational therapy can make everyone's lives a little bit easier, and the importance of incorporating it, and of course how we can help maybe lower those numbers of depression in our senior population, because we need to see those numbers go down. So thank you for giving us a resource to do this, and thank you for joining us today.
Thank you so much.
Of course.
Appreciate it.
Until next month, we appreciate you joining us today, and we will see you next time on Active Aging.